Thank you, Devin, and thanks everybody for taking the time. Uh, Gauss is really typically focused on operating room and surgical applications with AI. We've built a number of iPhone and iPad apps for those settings. But in light of the COVID-19 crisis, we decided to spend about 5 or 6 days building and deploying the solution, which is now live. Officer is an ER doc and works at an urgent care facility, and just hearing his stories and stories of those around us, our colleagues, our families and friends, we decided to build something that we can just deploy for the good of everybody in these health systems that we're working with today. So we've seen that on the front lines, healthcare workers are being exposed to a surge of new patients who require manual triage. This is at ERs, EDs, urgent care facilities, primary care facilities, even if the presenting reason is not COVID-19 or COVID-19 worry. But this process we found is inefficient and risks prolonged exposure to COVID-19. You can see in some of these photos that it's kind of a manual process today. We look to automated passport control as an operational analogy for how to screen visitors efficiently and at scale. If you look at a manual screening versus the concept of automating passport control or mobile passport, there's a very big difference in how flow occurs. So we built an app called Apollo, which delivers what we're calling a whole new category, contactless triage for COVID-19 at the front lines. It's very easy to use and to set up, and this can be adopted by any health system without really any integrations or really any setup. Or there are some interesting integration options on the back end. Step one, we just place these signs in front of these ERs. This is not dissimilar to what folks are doing today. They usually place signs that say, stop, don't enter, get back in your car and give us a call. So we've built a really simple service where you can text Apollo to this number or scan a QR code. That instantly downloads an app. There's a native iOS app that's currently under review and should be out soon. And there's a web workflow that's very simple and fully responsive. Patient downloads the app. They fill out a CDC-based COVID-19 screening that's based on the latest guidelines. It's constantly updated, and it's been curated by a panel of ER doctors and experts. It encodes the results of that symptom screen into a QR code, just like a boarding pass. When the patient's ready, they turn their blinkers on, and the attendant at the front of that care facility walks up. They simply scan that QR code on their own phone to download instantly all of the screening results for that patient's COVID-19 screen. If they want to make a call to that patient through the window, they just tap a button and we can make an instant phone call to triage that patient further and complete the medical screening process. We've built all of these functionalities in the last 96 hours and shipped them. We've actually beta tested this successfully at a number of local care facilities here with our ER staff. What we're now doing is building additional features like video calling, automatic EMR integration, so you can actually take this information and shoot it over to a patient's chart. The benefit of this process is it really takes a manual COVID-19 screening, which is inefficient and has a high level or prolonged level of exposure, and turns it into an instant, high throughput, and no exposure process. Very simple to roll out at any health system, any test facility, any volunteer center, or even long queues. We simply place these signs and the app is instantly available to anyone who presents. Both the provider and the patient can use just their smartphone camera to access the app, either in native form or as a web app. Apollo is currently accessible in 7 different languages, and we're adding a number of additional languages. So it allows anybody to do a COVID-19 screen, and it's not limited in the sense of how many languages are available. It's also available, again, as I said, to any smartphone. So anybody with a smartphone can really use this tool. Most importantly, this is not a chatbot, and this is really not built as an at-home screening tool. There are a lot of really great tools out there for those. Many of them have been built to steer patients away from these ERs and care facilities, to sort of triage them away. What we're really doing is building the safety net that's focused on that interface between a presenting patient and the physical door of a health system, if that patient did not have a chance to go through a digital front door. It helps protect healthcare workers at the front lines. That's whom we've built this for. Number one, contactless screening reduces exposure to COVID-19 by reducing prolonged and direct contact with patients during screening. Number two is very efficient and allows you to scale a screening operation up to a massive population. So any patient, any care facility, even if you don't know who that patient is when they arrive at the front door, whether or not they have an appointment or went through a video visit or some other channel. And lastly, Apollo does not store any PII. It protects the patient's private data. It uses a de-identified and encrypted QR code. And we've built a very sort of sophisticated flow where we're never having that patient leave that very closed context of the patient and the provider at the front lines. It scales, as I said, to any test facility, emergency department, urgent care facility, or any other care facility where staff may be worried about an influx of patients who may or may not have COVID-19 symptoms and may or may not be presenting with an appointment or for that reason. We've built this purely for the safety of our frontline health workers. This is a completely pro bono effort at Gauss. This is really not our kind of core long-term business, but we've built this in with the hope that we can make an impact and help those providers who we really have to protect on the front lines and just allow them to be more efficient in the context of an incoming surge. So thank you all for taking the time and for being here. Really appreciate your interest in this space. And to those health systems out there, thank you for the work you're doing and your providers. We're all with you, and we're here to help. Thanks, Stone.
Thanks. Sid, one quick question. In the event that a patient doesn't have a smartphone, what's the alternative? How does that work?
Yeah, that's a really great question. We know that about 10 to 15% of patients do not actually show up with a smartphone. We're currently working on a completely text or MMS-based workflow that'll allow the same functionality without the use of a smartphone. So we're hoping to launch that soon.